How and why should I obtain a second opinion?
Personally, I think you should get a second opinion as soon as possible. And you might find that a third opinion and a fourth opinion would benefit you down the road. Most doctors I know, local oncologists, really appreciate an educated patient and may very well help you find a specialist in your area. But if, for whatever reason, your doctor seems offended, I honestly wouldn't hesitate to change doctors. I think it's awfully important from your standpoint, the patient, to do whatever is best for you and have your local oncologist support you in that.
So one extra complication in multiple myeloma is that the doctors don't always agree. And this is even the myeloma experts don't always agree. There are different philosophies of treatment. Some favor less aggressive treatment, some favor more aggressive treatment, some favor just different types of therapies that are being used in the clinic. Some of it is the research that they've done and the experience that they have with those. So what we suggest is that patients potentially get second or third opinions even when they're trying to make treatment decisions. And as you get more educated on different ways of seeing treatment options, you'll be able to ask better questions. Sometimes, if they don't agree, sometimes it's a matter of going to these second or third opinions and then making a decision based on your personal needs. So sometimes somebody might want an all-oral therapy, and that might be really important because you live really far from the clinic and getting infusions are really tough. Or it might mean that you're younger and you want a more aggressive therapy because you want to shoot for a longer remission point. And so some of these are personal goals and just what you want out of your therapy too, in terms of your goals with having myeloma.
If you put three myeloma experts in a room and ask them and give them the same information on the patient, all three of which will provide you with a different treatment strategy. But I think the important thing is that these myeloma specialists are so skilled and so up to date on the newest and best treatments. And what I mean by that is that in the last 4 years, we've had 6 new drugs, which is phenomenal. And as a result, there's so many options available to them that that they can come up with a different strategy or a different treatment philosophy, all of which will result in improved survival. And what I mean by that is that, myeloma specialists often will give you something on the order of 10 to 12 years of average survival, where the normal SEER data shows only 5 or 6. So it's very, very important that it be a myeloma specialist and that they do all the right things that you want. And one of which is you've got to decide on your own, what are your objectives? If you're older, maybe you don't want a stem cell transplant. If you're younger, maybe you would like to go for something very, very aggressive and try to cure the disease. So all these things are important, and what you'll find is that a myeloma specialist can provide you at least with a plan that provides you the best opportunity for improved life expectancy. It's what's best that fits your needs, and so you have to make that decision yourself with your doctor, obviously. If you in fact have a doctor who might be a myeloma specialist, but he just doesn't listen to you, doesn't believe in your objectives. If he wants to do something that you don't necessarily want to do and you don't want to, those are the things that they have to be sensitive to. So if you are uncomfortable with your doctor, don't continue to be uncomfortable with your doctor, because I'll tell you, there are some that just have an unbelievably great rapport with their patients. They are not only the best doctors for myeloma in the world. They're just outstanding human beings.
This is a tough slide, but I have to throw it in. It's okay to change your doctor. It's absolutely okay for certain reasons. You are the one who has the final decision, not your doctor. You have veto power. It's your life, it's your cancer. You make the decision. Your doctor is your advisor, he's your helper, he's your educator, but you make the decision. If your doctor's not willing to give you veto power, if he says, this is what you will do, I wouldn't like that doctor. If your doctor's unwilling to communicate with or take directions from other myeloma doctors, myeloma specialists, if your doctor's unwilling to let you go get second opinions. I always said as a physician that if I didn't let my patients get second opinions, it would mean that I had something to hide. Some doctor was going to find out that I wasn't really doing the right thing. I encouraged second opinions. Change doctors if your doctor's unwilling to listen to you, if he really doesn't, she doesn't listen. If your doctor's not willing to be educated with information from important groups and studies, those are all reasons to consider getting another doctor, changing doctors, maybe getting another opinion. Do not change your doctor just because you're miserable. You're in different stages of your treatment journey. If you don't feel good, it's not your doctor's fault. Tell him or her, maybe they can use things to help you, but that's not a reason to change doctors.
To get a second opinion, find a specialist on HealthTree that is near you or that has research interests that are aligned with your situation, and contact them. And if you need help, email us at the Myeloma Crowd at info@crowdcare.org so we can help you find a myeloma specialist.